Hi, welcome to the Sacred Secret Society. My name is Lorene, and I'm here to just talk about some things going on in our world these days. If you are here to find out what I have to say the sacred secret is, I'll just let you know now. It's all within. Go within, go look within yourself to find that. The best way to get spirituality closer to God is through your body. So go do some exercising, at least 30 minutes every day. Find it all within yourself. I am coming to you today to talk about something that I found out about a few years ago, something called Ehlers Danlos Syndrome. Now, this is something I had never heard of. I've worked in healthcare most of my life. I started as a CNA when I was 18. I got my CNA, and then I got my CMT, where I was able to, so if you don't know what a CNA is, it's Certified Nursing Assistant, or Certified Nurse's Assistant, and I would help work in the nursing homes. There were a couple nursing homes I worked at, moved up through one of them. The one that was an Alzheimer's unit was definitely the hardest. That is a very hard job, so if you do that, my hats are off to you because I could only do that one for about 6 months. I then became a CMT, which is Certified Medication Technician, where I would pass out the pills to the elderly who lived in the nursing homes. And then from there, I got my wound, was able to help them with their wounds and their bed sores. They had those when they came back to the hospital. After that, I went into a couple different specialists' office. I worked for a dermatologist for a few years, and then I worked for an endocrinologist, who had a lab on site at the endocrinology office. So I've been in healthcare a lot. I've seen a lot of things, and I've heard a lot of things, and I had never heard of Ehlers Danlos before until my sister told me about it after I had my second daughter. So I got some definition here of exactly what it is, but just a brief synopsis is from my experience, it's mostly the hypermobility that causes pain. And the reason it causes so much pain is because your tendons are loose. They don't hold the joints well enough together, so they move out of place. So that's why you'll see me wearing these gloves. My hands is really a sore spot for me. These little joints right in here like to go out of place, so it's really swollen on my hand from moving in ways that they're not supposed to move. My knees have always hyperextended. I used to walk on my toes, curl them up, and I was able to walk around. Don't do that. My toes are very painful now. I also have little joints on the top of my feet that like to move out of place now. So as I get older, more things are starting to move out of place. So that's one reason I say get out and exercise, and I will eventually be kind of showing some of these basic exercises, but you really need to start off very, 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 very small. There are some great resources out there, and we'll get into a little bit of that, but the mascot is basically the zebra, because sometimes when you hear hoofbeats, it's not a horse. And so that is why I'm wearing this hoodie today. It is the Unheard Ones, and I know they don't put a lot of content out anymore, but I love this little zebra on it. If you have Ehlers Danlos Syndrome, you are a warrior, and we get put through the ringer. And I literally have stacks and stacks of paperwork that I have gathered over the years and CDs of imaging that they've done on different joints. The first time I had a hint of something being wrong, I mean, it was through childhood when I found out about scoliosis, and I found that out through a chiropractor at a little town fair. They had little booths, and my mom let me go in there to see if my spine was straight, and he said, no, it's not, and that I needed to come in to get adjusted. Well, we didn't really have the money for that, so I did it, I think, maybe with the free consultation, but then after that, we didn't go anymore, which is actually good, because they say now that I've done a lot of research, chiropractors are really not the best for us because our joints are already hypermobile, So you don't want them to go more out of place, or the chiropractors to take it out of place. I have seen a lot of chiropractor in my day. I've had a few that tell me that they do understand it and they do know what's going on, and then come to find out they don't. And I've been injured by both chiropractors and physical therapists. So it's really, really important that you find a provider that really understands the syndrome, which is the heart of the problem with this. Most people don't even know what it is. As I said, I've worked in different specialties. I had never heard of Ehlers-Danlos before. So the Cleveland Clinic defines it as a group of 13 inherited disorders that weaken the body's connective tissue, collagen-based structures that support the skin, joints, blood vessels, and organs. Characterized by hypermobile joints, soft, stretchy skin, and tissue fragility. It causes symptoms ranging from mild to life-threatening. There is no cure. So treatment focuses on managing symptoms such as pain and joint instability. Now, if you are a woman, unfortunately, the healthcare system is not our best friend. If it is your best friend and you've had great experiences, I am so happy for you. But specifically with Ehlers-Danlos, a lot of doctors will brush you off and say, you're a woman, you have pain, maybe you're being emotional, maybe you're hormonal, which hormones probably do play a part, but that's part of the problem, is that they don't know enough about Ehlers-Danlos syndrome. So I want to talk about it a lot. I think that doctors today need to look at people for their whole body, not just look at the individual symptoms. Right now, healthcare is so divided. As I said, I worked for dermatology and endocrinology, but our body is one whole system. And yes, we do have those different systems within it, but it's very important to look at the patient as a whole. Well, after I found out I had Ehlers-Danlos syndrome, through the criteria that is out there today, which we'll go over, I went to doctors and I asked for help, and most of them looked at me like I was crazy. I joined groups, Facebook groups, to maybe find some other people who had some good tips, and it's a problem in the community as a whole. We are not believed. It is all in our head. You'll go see a primary care doctor who wants to refer you to rheumatology. And the rheumatology doesn't know what to do, so they send you to endocrinology. Endocrinology doesn't know what to do, so they're going to send you to another one, or a different rheumatologist, or then they'll send you to neuro, or the best of them all is the psychiatrist. That's usually the one who ends up with us, because they cannot find any lab work wrong. They say that there's nothing wrong, so you're fine, so it must be all in your head. Well, I'm here to tell you it's not. And if you have this, I'm with you, and I am so sorry, and we can get better on our own. We don't need this healthcare system to help us. We can help ourselves. We can go within and help ourselves. But the knowledge is power, and that's really the first step, is knowing what's wrong. So I'm going to do a whole episode on just the criteria, because there is so much there. I just kind of want to do a brief overview of what it is. So the 13 subtypes, the most common one is the one that I believe I have. And the reason I say believe is because there is no diagnostic tool. There is no definitive answer based on blood work or genetics. It is a genetic disorder. This is something that is in your bloodline. So it can come from either your mom or your dad. It doesn't have to come from both. It is, I can't think of the word right now. It's just one parent needs to carry the gene. You don't have to have both. So I believe that I got it from my dad's side of the family. So if you're watching this and you're my family at all, please reach out. I'm happy to talk about it and point you in some direction to get some help. But it is the most common form, and it's basically caused generalized joint hypermobility and pain, skin fragility, your scar easier. I remember getting stretch marks when I was young on my inner thighs, even though I was very skinny. I just got stretch marks. Nobody knew why. And another thing is the stretchiness of the skin. So I always wondered why, but my skin has always stretched out. There's also, like, if you look at your knuckles, they call them the elephant footprint because they're so wrinkly. So you can kind of see that. And it's the same, like, on my face, above my eyebrow, it pulls out. Here it doesn't pull out as much, but on certain parts of my body, the skin is very stretchy and very thin. It's almost translucent. You can almost see through it on some places. So that on top of my vitiligo, I have some skin stuff going on, which is one reason I loved working for a dermatologist. It was very interesting, and I learned a lot from him. But I never heard of Ehlers Danlos Syndrome. Again, so another type is classical EDS. Another thing I didn't mention is that when you write this down, it's capital EDS. And so when you're talking about the different types, you put a smaller letter in front of the EDS. So hypermobile Ehlers Danlos is going to be a lowercase h, capital E, capital D, capital S. When I get more computer and podcast literate, I might have something up on the screen. But for now, I'm just going to talk. So classical CDS is CEDS, and it's characterized by high stretchy skin, atrophic scars, and joint laxity. So they also have that joint laxity issue where things like to go out of place a little bit. That's part of it. They go out a little bit. So instead of just a full-on dislocation, it can just subluxate and just go partially. And you just kind of have to work with it and get it back into place. So exercise is super important to keep your muscles strong and keep those joints in place. So the classical like CDS or EDS is going to be the CL EDS. This is a rarer type, and it is classical or it's similar to the classical, but it lacks the atrophic scarring often caused by a TNXB mutation. And so that's another thing. All of these, except for the hypermobile, they have found the gene for. Now, Norris Lab is doing a lot of work right now, and they have put out some recent work where they think they have found the joint or the gene. So fingers crossed that that is the case. It might actually end up being that there are more than 13 types of EDS. There's a lot more money and research that needs to go into this syndrome, because it's not a disease, it's a syndrome. You were born with it, and you may have a wide variety of issues that come along with it, because again, it's connective tissue. So think anything in your body. It can literally affect anything. And I am so I almost want to say lucky that I have the hypermobile, because it's the more common type and it's not the most life-threatening. But when I first started learning about all of this about 4 years ago, it was pretty life-shattering and altering and devastating. So if that is you, again, you are not alone. Please reach out to help and find people who understand and can help support you, because it is very painful. And then on top of that, going to healthcare providers who tell you nothing's wrong just adds to the pain instead of alleviating it. Back to the list. Okay, vascular EDS, VEDS. This is a very, very severe type affecting blood vessels and organs with thin, translucent like skin. So as I said earlier, my skin is kind of, translucent in some places. It really affects the VEDS. And again, that's vascular. So all your veins, the way the blood flows through, those are affected. So it's pretty hard. That one I think has the lowest life expectancy, and I think it's up to about 50 on that one. So you really want to do the genetic testing to see what type you have. We got the cardiac valvular EDS, so the CVEDS, and this is another rare one, and it affects the heart valves, causing severe progressive cardiac issues. So it's also one that really affects the vascular system. Arthrochalasia EDS involves severe joint hypermobility and congenital hip dislocation. Dermaspraxis EDS is DEDS, characterized by extreme skin fragility and sagging. Then we got the kyphoscoliotic EDS, causes severe spinal curvature and eye fragility. Brittle cornea syndrome, which is BCS. That one is missing the EDS. It's just BCS. And that affects primarily the eyes, causing thin, fragile corneas. And then we've got the spondyloelastic EDS, which is the SPEDS, characterized by short stature, muscle weakness, and limb bowing. We got the muscular contractural EDS, which is MCEDS, and that involves congenital contractures, club foot, and distinctive cranial facial features. So you can really tell. Part of the reason I didn't put any makeup on is so you could kind of see. I do have sagging in one eye. I never realized until I was in a relationship with a not very good guy who told me like my face was crooked, and I was like, no it's not, what are you talking about? But if I smile, you'll see it kind of comes down on this side a little bit. So this side sags a little bit more than this side, and I had no idea until I was in my mid-20s. But it's the lazy eye can be a sign of this. There are a lot of signs throughout your life, and I think a lot more people have this than they want us to even believe, because I think it also comes with some, superpowers. They say your weakness is also your superpower, and I believe in that. Knowledge is power. Now that I know what it is, I can take care of myself better and really learn from it, and again, take care of myself better, make sure my girls are taken care of, be there for anybody else who may need the assistance, because I did not have that. So I want to help provide that for anybody who needs it. A couple more. We got 3 more. We've got, I did the muscular contractural. We're going to do the myopathic EDS, which is the MEDS, causes muscle weakness and atrophy, which often improves with age. So they do say that it can progress and get worse as you get older, but it's all in what you do with it and how you take care of yourself. So that's going to make a big difference. And then we got the periodontal EDS, PEDS, marked by severe early onset gum disease, so periodontists. So it's important for all specialties. They have divided us up into almost 13 different specialties that you can go to, and these doctors need to understand that it doesn't just affect one, it affects them all, and these doctors need to work together to help patients. Like, that's their job, right? That's what they're supposed to be doing. So the key characteristics and symptoms is the hypermobility. Joints move far beyond the normal range, leading to frequent dislocations and chronic pain. Skin, the elasticity and fragility. The skin is soft, velvety, highly stretchable, with a tendency to bruise and scar abnormally, which I do bruise very easily. My girls also bruise very easily. There are some awful cases out there where CPS gets involved, or the healthcare providers, thinking the parents are abusing their children because they come in with so many bruises or an injury. Their joints are going out of place. So how does that happen? Well, EDS. There is a reason for it. And so some of these parents have gotten their kids taken away, and it's devastating and it's heartbreaking, and I can't even imagine what that would be like. But my joints that are the most hypermobile are really my knees, my feet, again, the scoliosis, that doesn't go away, my hips. So when I was in my early 20s, I went to an orthopedic doctor because I had so much lower back pain. And he told me that my SI joint moved, which is your sacral iliac joint. And so he told me that moved, and that just happens for some people. Well, come to find out, 20 years later, that's not true. It does happen to some people, but usually when it comes along with the genetic disorder that causes it. And Hypermobile Ehlers Danlos is most likely going to be the cause for a lot of people that they don't even address. It's not on your symptom spreadsheet when you go to the doctor. Most doctors will look at you crazy if you bring it up, although it's been known about for over 100 years. It was first found in the early 1900s and named by two doctors, Ehlers and Danlos, which is where it got its name. So some of the complications that you can get here, depending on the type, it can affect the blood vessels, like I was talking about with the vascular type. That really, I mean, that's the most important thing in our body, right? The blood and the heart keeps everything going. Well, when you have this syndrome and it affects the vascular system, a lot of times the blood vessels are too weak, and so they can cause aneurysms, and they can break open anywhere in your body. It's pretty scary, and you really need good doctors who really understand it and can be there to provide assistance. They cause sometimes fatal ruptures. Others include severe fatigue, gastrointestinal issues, dizziness upon standing, also known as POTS, or postural orthostatic tachycardic syndrome. And that is where you stand up too fast, your blood can't get there fast enough, and so it'll make you pass out. In my mid-20s, I remember being at Planet Fitness one time, and I was trying to, get in shape, and I was running on the treadmill, and I felt so dizzy and lightheaded, and I didn't know what was going on. So I just went into the gym and I sat there for a while, and like literally talking about it right now is making my stomach hurt. Gastrointestinal issues. It really will make you feel nauseous, and it's not fun. Some people will have seizures. It is a connective tissue, so it can literally affect any tissue in your body. The most common type, the hypermobile, is the one where they have not found the gene mutation. I have had my genetic testing done. I did have one great cardiac doctor for a few months after I had my daughter, and he was great, and then he retired. But before he retired, he ordered my genetic testing. So I have had that done. I know it's not one of the 12 types that they do know the gene for, and the whole reason I got the test done is because of diagnosis in my immediate family. So I was able to get that testing. So that is one of the criteria that you have to meet. There is strict criteria, and again, they're changing that a little bit, I believe. But there's also something called HSD, which is hypermobile spectrum disorder, which is, again, a spectrum, kind of like EDS. It can affect you in a spectrum of ways. And the HSD and the hEDS diagnosis are very, very similar between the two. And they cause a lot of the same issues. So even if you do have just HSD, which I believe is in my chart somewhere, one of my doctors put it in there once upon a time. And it's basically the same treatment. They're going to send you to physical therapy. That's about all that they know what to do. Or send you to psychiatrist and tell you you're crazy. Those are really your options, which is heartbreaking. So one of the options that I found that really helped me is a program called Heal with Tracy. And it is a group of therapists, and she is, I can't remember her exact title, but she does have like a physical therapist that does live every Monday. She has an ergonomic specialist who will help you like make sure you're sitting right and using the correct posture, and just trying to get everything lined back up, because really that's going to be your first step, is really working those very small muscles deep within your body that you don't normally think about using. Ours really don't work. They're really hidden down there. So you really have to work hard to get your body strong. I've been on this road for approximately 2 years now, really trying to exercise and making very intentional moves with my exercise, because you have to be careful that you're not, like when I do my yoga, I have to make sure I'm not hyperextending, because then I'm not using the muscles that I need to make strong. So it's very, very important that you talk to somebody who knows what they're doing. And Heal with Tracy is a great program. I am also now, after I did that for about a year, my beautiful friend Bryce over there on Esoteric Atlanta has started a program with the beautiful Paula, and she also has a channel called Empowered Spirit Healing, and they have both been helping me extremely over the past year, really get I had the foundation from the last program, but this is really getting me even more so in my body and healing so much better than I have in ever. So I owe so much to them and could not thank them enough for this program that they put out, because it's really, really helped. So treatment is supportive, focusing on increased stability and reducing pain. This includes physical therapy to strengthen muscles around joints, using braces, wheelchairs, and regular cardiovascular monitoring for the dangerous types like the VEDS. The life expectancy is worse for the cEDS, which is classical, and the VEDS, again vascular, usually 48 to 51 years. It's present from birth, but diagnosis varies greatly. So when my second daughter was born, she did not start walking until she was almost 2. We did do some physical therapy with her. She was actually hospitalized once with some breathing issues right around her first birthday. So she has already had some experiences with this, I believe. I'm not 100% sure. They don't diagnose it until, well, I'm still 40 and technically haven't gotten an official diagnosis from somebody, because they pass it off. Nobody wants to handle this. And a lot of people say, well, you don't want to get diagnosed because then it will affect things like your life insurance or eligibility for insurance. When doctors and insurance companies don't know what it is, they don't want to insure you. So that's why we need more awareness in this syndrome, so we can get some more help to figure out what's going on. Norris Lab is also a great resource. They are doing some great work. Courtney was one of his lab students, and he basically came and said, if you want to study anything, let me know. And she said, well, I do. They don't know what causes this. And so they started working, and they've been doing a lot of work ever since. And I'm so I love it. I love that there's something's happening, because again, in the 20 years I worked in healthcare, I had not heard about any of it. So we really need more awareness. The diagnosis age varies greatly, often delayed, with an average diagnosis around 24, though most don't get answers till they're in their 40s, especially women. Children are diagnosed with pediatric hypermobility, reevaluated at maturity, around 18 for the adult Hypermobile Ehlers Danlos criteria, as early symptoms like pain can prompt early physiotherapy. So again, when I went to the orthopedist in my early 20s, he told me to go to the physical therapist. I did water therapy, and I did some therapy there for a while, but was never told about Ehlers-Danlos or hypermobility. We didn't talk about that. So I did not have a knowledgeable therapist. He was in his young 20s and did not know enough to really help me like he should. So make sure you're very specific with your questions, and I'm going to go more into detail about all of that. It is a controversial due to diagnostic challenges, especially for the hypermobile Ehlers Danlos, because its specific gene is unknown, leading to reliance on subjective clinical criteria and confusion with other conditions like fibromyalgia or anxiety and depression. It's all in your head. I have that too, especially some medical, PTSD a little bit. Every time I think about going to the doctor, my stomach turns. I get really anxious. Like I feel right now my heart's starting to race a little bit, because every doctor's appointment I have had in the past few years have caused more harm, and I'm arming myself to where I can go to the doctors and maybe be a little more rational, because when you're talking about yourself in a closed room with just one other person who doesn't believe you, then it gets rough. We'll just say that. If you've never been there, I'm so happy for you. I wouldn't wish it literally on my worst enemy. Healthcare providers lack awareness. Diverse multi-systemic symptoms and historical medical gaslighting contribute to the misdiagnosis, prolonged suffering, and patient frustration with the condition often dismissed as psychological. So everything I've been saying this whole time, I got that all from the Cleveland Clinic. just some basics. But again, the things that have really helped is going to the Ehlers Danlos Society. They have so many resources there at their website. They have a YouTube channel. There's also a therapist named Jeannie DeBon, I believe, who just recently put out a good book about physical therapy and some exercises you can do. There's a book called Disjointed that I've heard really good things about. I haven't tried that, but that is a good one. If you have gastrointestinal problems, I know that was a really, really big one for me. Doing some really deep breathing can really help alleviate some of that. Also, the hip exercises that Bryce teaches, you can get a free trial for that if you go to her website. I believe you get 7 days for free if you try, and if you want to link to that, it's there at the top of my YouTube channel. And then again, that Heal with Tracy program was really good. So I hope that if you are just now learning about Ehlers Danlos Syndrome and you think you may have it, you go to some of those resources. Please feel free to email me. I do have an email of the Sacred Secret Society at proton.me. And I'm happy to answer any questions or point you into some specific directions if you need some more assistance that I am not able to help you with. I am, just trying to hang on and get through the pain every day. And I'm still so grateful to be alive. I'm still here for my girls. When I first found out about it, really thought that it was the end for me. I had some really, really hard heart issues after I had my daughter, through both of my pregnancies, and I had gestational diabetes with both pregnancies. Really got worse with the second one, but they say that pregnancies can exacerbate I can't say that word, exacerbate the symptoms. So if you feel like you have declined, like I had the severe postpartum depression with both, again, worse with my second. And there were also some other extenuating circumstances that played into that, partially learning about this. This was one of those circumstances. And so I was seeing cardiologists, and they again sent me to rheumatology, and then they tried to send me to the KU Spine Center, who after I get there, we don't treat that. We don't look at that. And it's disheartening. I went into healthcare because I wanted to help people. So if you're in healthcare, please help your patient. Don't look at those textbooks or go to AI. Listen to the patient that's sitting in front of you and really listen to them and try to be there for them and help them. Don't dismiss them. It's not just another number as much as that has turned into our healthcare system these days. It's, pushing those numbers. We are people and we deserve real healthcare. So if you're not there to help people, maybe it's not the right field for you. I'm just going to suggest that there. But if you are in healthcare and you are helping people, thank you for what you do. It is not easy, whether it's dentistry or CNA work, CMT work, RN, LPN, social work. There are so many great, great people in the healthcare system, and for everything that you do, thank you so much. And if you're ever a doctor that has ever dismissed one of their patients, I hope you have the day you deserve. And I hope that you never have to deal with something like this, or any of your children have to deal with something like this, and that maybe you listen to your patients when they come in and tell you what's going on with them. And again, if you don't want to help, then get out of the way. You don't need to be in healthcare if you don't want to help. That is literally the point of healthcare, is to help the patient in front of you. So I wish everybody a wonderful, wonderful week. I am grateful to be here and to be able to have the courage to sit here and do this with you and explain some things and hopefully help. If you do have, again, any type of hypermobility in your body, this could be the answer. Dig in a little bit, try to teach yourself some things, and so that you can heal yourself, because you do have the power. That power is within. That is the most sacred secret out there that they don't want you to know. It's all within. So go within and find it. And it is my joy and pleasure to live another long-lasting, wonderful day. I hope it is the same for you.